So today we're going to talk about Dutasteride, which is a drug that is used to treat prostate problems. So indications or uses of this drug. It is used on its own as a monotherapy or in combination with tamsulosin, which is an alpha adrenergic blocker for treatment and control of symptomatic benign prostatic hyperplasia in men with enlarged prostate in order to improve symptoms and also reduce the risk of acute urinary retention and the need for benign prostatic hyperplasia related surgery. So these are the indications for taking the drug. Okay, the dose is 0.5 milligrams once a day. This dosage is the same even for the elderly. So it can be taken with or without food, and it has to be swallowed as a whole and not to be chewed. So basically the pharmacology of this drug is it reduces the circulating levels of DHT, dihydrotestosterone, and it does that by stopping or inhibiting both type 1 and type 2 5-alpha reductase isoenzymes, which is responsible. So these two are type 1 and type 2 5-alpha reductase enzymes are responsible for the conversion of testosterone to 5-alpha dihydrotestosterone. So contraindications. So in what kind of patients are we not supposed to give this drug? So firstly, people who have allergy or hypersensitivity to dutasteride or other 5-alpha reductase inhibitors. Secondly, patients with severe hepatic impairment, women, children, and adolescents. Okay, so we're not supposed to give this drug to these 4 categories or 5 categories of people. So special precautions, monitor for obstructive uropathy in patients with large residual urinary volume and or severely diminished or decreased urinary flow. Okay, that's number 1. Number 2, we have to perform a rectal examination of the rectum with a finger, of course wearing gloves, and also do the serum PSA, prostate specific antigen level for prostate cancer detection. Thirdly, you might want to look for changes in the breast tissue. Example, look for lumps or nipple discharge. Okay, and be aware of breast cancer in males. And patients who are given this drug should avoid donating blood until at least 6 months after the last dose of the drug. Okay, and then combination therapy with alpha blocker. So when given in combination with alpha blocker or alpha antagonist like tamsulosin, so we have to be aware of patients with, again, mild to moderate hepatic impairment, and again, avoid use in women, children, adolescents. Okay, this has been mentioned previously. So adverse effects or unwanted effects of the drug includes impotence, okay, problems with erection, decreased libido, okay, so reduced sexual desire, and then we have ejaculation problems, probably, which might happen, and then breast disorders. Drug interactions, when we give this drug, okay, together with a CYP3A4 inhibitor, okay, cytochrome P450, 3A4, example, the calcium channel blockers like diltiazem, verapamil. So these drugs are going to impair the clearance or the metabolism of the drug. Okay. So the metabolism of the drug will be impaired. Okay, because of these CYP3A4 inhibitors. Okay, so these are going to block CYP3A4. CYP3A4 is going to be blocked. Okay, so when you block this, so the drug will remain in the blood. Okay, so over time we will have increasing blood concentration of the drug. Okay, so which might potentially cause toxicity. So we have to monitor if we want to give and try not to give together with the CYP3A4 inhibitor, example diltiazem and verapamil. Okay, so that's all for now. So we'll see you again in another video.